everyone, welcome to my emergency news vlog. Today, we will talk about how nurses quickly assess and manage life-threatening emergencies, trauma cases, and environmental injuries, and lastly, the disaster situations. Emergency nursing is very important because patients' lives depend on quick actions and correct decisions. Nurses play a vital role in early assessment of patients, providing life-saving interventions, and stabilizing patients before further treatment. And in an emergency situation, every second matters, so nurses must stay calm, think fast, and follow systematic approaches. One of the most important methods used in emergencies is the A, B, C, D, and E assessment, which helps nurses quickly identify life-threatening problems. So for the primary emergency, we have to use the A, B, C, D, E approach to quickly assess the patient. A is for airway, so we have to check the airway first, if it is open and clear. If the airway is blocked, so the patient cannot breathe. So we have to remove obstructions and position the airway. We have to use the airway devices if it is needed. For breathing, we have to check the patient's breathing properly, observe respiratory rate, chest movement, and oxygen saturation, and provide oxygen, assess ventilation if needed. C is for circulation, so assess the blood circulation of the patient. We have to check the pulse, the blood pressure, and signs of bleeding. We have to control the bleeding and start IV fluid. And for the D is disability, evaluate neurological status. Simply check the level of consciousness of the patient as well as the pupil reaction. And the E is for exposure, expose the patient to check for injuries while maintaining body temperature. In emergency condition, we have to do triaging, which means it is sorting of the patient based on the severity of their conditions. During disaster, nurses prioritize patients who need immediate life-saving treatment. In color categories, we may include red, which is the first priority. It is life-threatening but treatable. Yellow, it can be delayed, serious but not immediate life-threatening. And the green, it is minor injuries and able to walk patient. And lastly is the black, which is the expectant or the dead patient, which is the last priority. Next is the BLS or the basic life support. It is the immediate care to maintain breathing and circulation until help arrives. So for example, if the patient has a cardiac or respiratory arrest and with the symptoms of unresponsiveness, no pulse, abnormal breathing, the steps we have to take is check for scene safety, responsiveness of the patient, breathing and pulse within 10 seconds, and call activate emergency help and get an AED. For the compressions, we have to put our hands at the center of the chest of the patient, 2 inches deep, 100 to 120 per minute, 30 compressions. And we have to do the head tilt chin lift and administer 2 breaths, watch chest rise and repeat 30 compressions and 2 administration of breath. Next is for choking. If it has airway obstruction, we have to check for signs, cannot speak, cough, clutching throat, and difficulty of breathing. We have to do the Heimlich maneuver, stand behind the patient, fist above the navel, and quick upward thrust until object comes out. If unconscious, call help and start CPR. Check the mouth for object. Next is the near drowning. It's the submersion injury causing hypoxia, which is caused by water inhalation, and the symptoms of respiratory distress, cyanosis, and altered mental status. The priority nursing intervention is to provide oxygen therapy and prevent hypoxia, as well as to monitor respiratory complications. So we have to remove the patient from the water, check for the airway, breathing, and circulation, and give a high flow of oxygen, assess ventilation if needed, and monitor oxygen saturation, lung sounds, and watch for the acute respiratory distress syndrome. Next is the hemorrhagic and shock. It is a severe bleeding from external or internal sources, which is caused by trauma, lacerations, or vessel rupture, and with the symptoms of bleeding, low BP, tachycardia, and pallor. The priority nursing intervention for this is to apply direct pressure, use tourniquet if uncontrolled, and administer IV fluids. For bleeding control, we have to apply direct pressure and elevate the limb. If it is severe, then tourniquet above wound. For IV fluids, we have to use large bore IV and isotonic fluids and monitor the vital signs. For shock, it is the inadequate tissue perfusion causing cellular damage. It caused by hypovolemic, cardiogenic, or distributive shock. The symptoms of this is hypotension, weak pulse, pallor, and confusion. The priority nursing intervention for this is oxygen therapy, fluid resuscitation, and monitor perfusion such as the vital signs and urine output. Next is the head and spine injuries. This is a trauma to the skull or brain, which is caused by the falls, accidents, blows to the head. And the symptoms of this altered consciousness, headache, vomiting, and pupil changes. For the head, we have to monitor the Glasgow Coma Scale, pupils, and vomiting, and you have to elevate the head 30 degrees and avoid straining. For cervical spine, assume injury and stabilize neck, apply collar, and lag roll for movement. Next is the maxillofacial and soft tissue injuries. It is the injury to the face or jaw, and it caused by blunt or penetrating facial trauma. And the symptoms is airway obstruction, bleeding, and facial deformity. For airways, we have to clear blood, suction, and be ready for advanced airway. For bleeding, we have to apply a pressure, sterile dressing. For wounds, clean and remove debris, dressing, and tetanus if needed. Next is the bone and joint injuries. It is the fractures or dislocation affecting bones or joints, and it caused by trauma, falls, and accidents. The symptoms of this is pain, deformity, and limited movement. We have to check the circulation, sensation, and movement. Immobilize above and below fractures, and splint with padding. Next is the crush and multiple injuries. It is the compressions of the body parts using tissue and vascular damage. It is caused by trapped under heavy objects, and symptoms of this is pain, swelling, dark urine, and numbness. First is the crush. Watch for 5 Ps: pain, pallor, paresthesia, paralysis, and pulselessness. And we have to watch for aggressive IV fluids. And for the multiple trauma, so we have to follow the A, B, C, D, and E. So we have to check the airway, breathing, circulation, disability, and exposure, and treat life-threatening issue first. Next is the environmental emergency. First is the heat stroke. So it is a life-threatening hyperthermia, which is a sign of high fever, confusion, hot dry skin, and intervention is a rapid cooling, hydration, and monitor vital signs. We have to cool the patient fast, remove clothes, apply ice packs, and administer IV fluids. So next is the frostbite. It is a cold injury where body tissues freeze due to prolonged exposure to extremely low temperatures. It is commonly affecting the fingers, toes, ears, nose, and cheeks. The early signs of this is cold, pale or red skin, numbness or tingling, hard or waxy skin, and loss of sensation. For severe signs and symptoms, patient can have blisters after rewarming, blue or black discolorations, and severe swelling, and lastly, tissue death or necrosis. For the priority nursing interventions, we have to move the patient to a warm environment immediately, and remove wet or tight clothing, and rewarm the affected area gradually. Use warm water, about 37 to 39 Celsius, for 15 to 30 minutes. Do not rub or massage the affected area. It can cause tissue damage. Next is protect the affected area with sterile dressings and elevate the affected extremity to help reduce swelling. And we have to administer also pain medication as ordered. And lastly is to monitor for infection or tissue damage. Next is the hypothermia. So it is a life-threatening condition in which the core body temperature drops below 35 Celsius due to prolonged exposure to cold. The signs and symptoms of this, so we have the mild hypothermia, which is the patient can manifest shivering, cold, pale skin, confusion, and fatigue. For moderate to severe hypothermia, the patient can have will manifest slurred speech, slow breathing, weak pulse, loss of coordination, decreased level of consciousness, and possible cardiac arrest. The priority nursing intervention for this is to remove the patient from the cold environment, then remove wet clothing and dry the patient, rewarm the patient gradually. So we have to use warm blankets or warming devices. Then we have to provide warm fluids if the patient is conscious, and administer oxygen if needed. Then we have to monitor vital signs closely, watch for arrhythmias and respiratory depression, handle the patient gently, which is rough movement may trigger cardiac arrhythmias. And lastly is we have to prepare for advanced warming measures if severe. Next, for the animal and insect emergencies. Next, the bee stings. It is the immune response to allergen caused by bee sting, food, or drug allergy. Signs of this is swelling, itching, and respiratory distress and hypotension. For the intervention is to monitor for anaphylaxis and epinephrine if severe. For bee stings, we have to remove stinger, apply antiseptics, cold compress, epinephrine if anaphylaxis. So next is the snake bite. It is an injury caused by the bite of a snake that may inject venom or the poison into the body, leading to local tissue damage, bleeding problems, and nervous system effect depending on the type of snake. The sign and symptoms of this, so we have the local symptoms, which is pain at the bite sites, swelling or redness, fang marks or puncture wounds, bruising or blistering around the bites. And we have the systemic symptoms, which is the nausea and vomiting, weakness or dizziness, difficulty breathing, bleeding from the gums or wound, numbness or tingling, and paralysis if severe cases. Next is the priority nursing interventions. So we have to ensure patient safety and remove from the snake area. We have to keep the patient calm and still because anxiety increases venom spread. We have to immobilize the affected limb and keep the limb at or slightly below heart level. We have to remove also tight objects such as rings, bracelets, or tight clothing before the swelling occurs. We have to clean the wound. Gently wash with soap and water. Do not cut the wound or suck the venom. Avoid tourniquets unless specifically ordered. We have to monitor vital signs frequently, watch for shock, breathing problems, or bleeding. And we have to administer oxygen if needed, and prepare for anti-venom therapy. We have to follow physician's order, and lastly, we have to document and monitor progressions of the swelling. Next is the poisoning. It is the toxic substance exposure causing systemic effects caused by ingested, inhaled, or skin contact. And signs and symptoms is nausea, vomiting, and altered mental status and cyanosis. So if it is ingested, identify the substance, contact the poison control, and give activated charcoal if indicated. For carbon monoxide, move the patient to fresh air and give 100% of oxygen. For skin contamination, remove clothing and wash the skin. And lastly is the use PPE. Next is the mass casualty or the terrorism. It is the event causing multiple casualties from the weapons or explosives. It is caused by chemical, biological, and radiological or explosive events. And the sign and symptoms is multiple patients, burns, and chemical exposure. We have to apply triage, prioritize life-threatening injuries, and activate disaster plan and prepare supplies. We have also to coordinate with the emergency medical services, police, and fire teams. Next is the K principles. So we have to do rapid assessment for airway, breathing, and circulation, prioritize the most critical patient, ensure scene safety and PPE, communicate with your team, and be ready for mass casualty situations. Studying emergency care teaches us critical lessons such as in the emergency preparedness. Being prepared saves lives and improves outcomes. The role of the nurses: we are the frontline responders and leaders in the disaster situations. The lesson I have learned is that rapid actions, teamwork, and continuous training are essential in emergency situations.